Good morning, welcome back to your Feel Good Breakfast Show. This is Expresso, in case you're wondering, live in S3. And we have got some very, very important info for you. Now, here's a stat that's going to shock you, but there are nearly 500 million people living with diabetes worldwide. And that is an incredibly high statistic for preventable disease, if you think about it. And even more worrying fact is that 75% of people with diabetes live in low and middle income countries, meaning that access to insulin and proper treatment still remains a massive challenge for so many.
Yeah, scary thought for South Africa as well, indeed. Now, with World Diabetes Day being marked every year on the 14th of November, we are joined by endocrinologist Dr. Zane Stevens as we learn a bit more about this disease. And of course, you, Mzansi, can also come through. If you have any questions for the doctor, anything at all, come through and head to our Expresso Facebook page right now, where we'd be gladly enough sitting down here to answer all your questions. But without further ado, doctor, how are you doing this morning?
Good. Thank you very much for having me.
It's good to have you here. Obviously, this is something important, I think, for South Africans as well, something we're not always that aware of. But let's get to the basics. What is diabetes?
So the word diabetes just refers to the fact that your blood sugar is elevated. Now, our blood sugar is normally very well regulated by the hormone called insulin, which comes from the pancreas. And insulin helps us to get the blood sugar into the cells where we're going to be using it for energy.
Yep.
And the problem is either that you don't have insulin or that there's what we call insulin resistance. That insulin just can't do its job effectively to be able to help you regulate your blood sugar. And if you live with this high blood sugar for many, many years, that affects the function of our cells and leads to the well-known complications of that condition.
All right, that's the basics. But there's always a complication when somebody chats to you and they say, hey, I am a diabetic. And then they say, no, I'm type 1 or type 2. For those who are not in the know about what these types are about, can you give us the differentiation between type 1 and type 2?
Sure, and many people don't know this.
Yeah.
So the majority of people in the world will be living with so-called type 2 diabetes. And this is the lifestyle-related condition where you may have a genetic predisposition, so many family members may have the condition, and over time, through adopting probably unhealthy lifestyles, and particularly weight gain, you develop this concept of insulin resistance. So those people don't necessarily need insulin, especially at the beginning of their condition.
Yeah.
They need to make lifestyle changes and so on. People with type 1 diabetes, that's a completely different cause of the diabetes. That's an autoimmune condition in general. So there the problem is the pancreas is damaged by the immune system and you can't produce insulin, and these people need insulin therapy from the get-go.
All right. Me as an individual, how would I actually know that I have diabetes? I mean, are there signs and symptoms that are showcasing, dude, you need to go to the doctor, you need to sort this out? I mean, is there anything like that?
Sure. So this is a big problem, actually, because the majority of people, as I said, live with type 2 diabetes, and you can walk around with a chronically high sugar for many years and be completely oblivious to the diagnosis. So in the beginning, there really aren't symptoms. So the most important thing is to think about the fact, if I'm at risk, I come from a family carrying a bit of extra weight, you want to speak to your doctor about screening for diabetes. It's really once the sugar levels become quite high that you start experiencing the typical symptoms of passing large amounts of urine, drinking a lot, and losing weight. But that's often, very late in the game. In type 1 diabetes, those symptoms occur very early, but for the majority of people, it's often asymptomatic.
Well, now we've got the basics, the foundation. I know that there are many questions that have come through on the Expresso Facebook page. If you have any, we have a part 2 for you as we chat to Dr. Zane Stevens about diabetes for World Diabetes Day. Any questions, go over to the Expresso Facebook page and we'll be happy to answer them.
It's my Feel Good Breakfast Show.
We are back. Yes. Endocrinologist extraordinaire, Dr. Zane Stevens, is still on your couch. And we are unpacking diabetes in our health topic this week. If you have any questions for the doctor, head over to the Expresso Facebook page and we'll be answering your questions shortly. Part 3 is that time. We will get to all those questions. For now, let's go back to it. Now, we gave you the foundations of diabetes with Dr. Zane Stevens, of course, but now we need to get a little bit further, which is vitally, vitally important. Now, the thing is, when somebody is diagnosed, I feel like that's something that you need to really know about and actually understand what will happen. And the thing is, the greatest fear comes from a lack of education, and that's why we're doing this today. So when you're diagnosed, what happens then, doctor?
So I'm going to focus on type 2 diabetes because that's by far the most common.
Yes.
And what you're saying is really true. I think at the time of diagnosis, you've got to realize you could have lost 6 years of your life. That's what the stats show.
Yes.
So we've got to get this right from the beginning. So we've got to think about the important lifestyle changes, specifically weight management, because that's one of the biggest drivers of type 2 diabetes.
Yeah.
And then if you need treatment, which most people do, adherence and staying on that medication is so vitally important, and regular follow-up. So one of the mistakes I often see is people say, well, I was started on treatment and they saw their doctor a couple of years down the line, and you've missed the opportunity to prevent complications from happening because you didn't realize the condition wasn't optimally controlled. So even if you are doing really well, checking in with your doctor twice a year is what's advised globally, and really people should be doing that to make sure that they do well with this disease.
Now, earlier you mentioned some people that might be prone to type 1 or type 2, depending on the lifestyle, etc. But what exactly makes people more potentially susceptible to diabetes or more vulnerable to it, let's say that?
Sure. So type 2 diabetes is a polygenetic condition, so there often are other family members. So you're born with a predisposition. But what triggers that predisposition, obviously, is the adoption of unhealthy lifestyle choices. So particularly weight gain, and that comes from consumption of food which are high in sugars and high in carbohydrates, which obviously get converted to sugars, which results in the disease happening. So poor diet, lack of exercise, a very sedentary kind of lifestyle adds to that, and those are the things that really trigger that predisposition.
Okay, so type 2 diabetes potentially can be curbed provided you are maintaining and leading a healthy lifestyle. It's not then necessarily anything to worry about, right?
I mean, this is so interesting. In the last sort of 5 years, we've come to appreciate that diabetic remission is actually a possibility.
Okay.
Studies have shown us if in the first couple of years after your diagnosis, if you can lose even just 10% of your body weight, that there's a 30% chance that you would be able to go into remission. So that means normal blood sugars without needing any treatment. And we should really be aiming for that in the largest majority of people who are newly diagnosed.
Can we just reiterate some of the cues for you to go and get yourself checked out? Because I think that it's something that I have to stress, because we speak about diabetes and all those stats, but there are many people living on this planet who don't know that they have diabetes. So just to give some of the pillars of when to go see a doctor, and also possibly the risks of actually not getting it treated properly and early. I think that's also very, very important. Not for scare tactics, but I think purely for education. So let's start off with some of the things that you'll notice about yourself that'll give you the cue to say, I need to go see a doctor.
Sure, and I mean, to your point, about half of people living in the world with diabetes don't know they have it. So if you come from a family history where there's multiple people in your family with diabetes, you've got to be concerned about yourself.
Okay.
If your body mass index, so that's your weight for your height, is above normal, so above 25, you're already at risk for developing diabetes.
Okay.
If you develop any symptoms which suggest that your blood sugar is elevated, you certainly have to get to a doctor quite quickly. And those would be passing a lot of urine, feeling very thirsty, and unexplained weight loss. So any of those things, diabetes has got to be a consideration, and you've got to go and be assessed.
And then treatment-wise, if you don't actually get yourself treated, what are some of the consequences there?
So we think about diabetes as a disease affecting blood vessels. On the one hand, small blood vessels, so eyes, back of the eyes, nerves and kidneys, and then the risk of heart disease, strokes and amputations on the large blood vessel side.
Scary to think about, but this is the reality we live in. Of course, Doctor, I can't thank you enough for schooling us, educating us, of course, and coming through and raising awareness for this right now. Of course, we're going to have one more conversation with you, and you, Mzansi, need to come through and ask us any questions that you might have, because we're going to be carrying on this discussion. So come through on our Facebook page right now to answer all these questions when it comes to diabetes, and we'll be wrapping things up just in a moment. So come through. The doc is here to serve us, and we'll see you in just a moment.
It's my feel-good breakfast show.
Yes, Mzansi, welcome back. Of course, it's Tuesday and we're choosing to spend it with you, and we're choosing to give you all the health advice that we can. And this morning we've been chatting about diabetes with the doctor himself. An interesting fact, there are nearly 500 million people living with diabetes worldwide. Now, that is an incredibly high statistic for mostly what is a preventable disease. Now, we're wrapping up this conversation with this week's health discussion, and we've got endocrinologist Dr. Zane Stevens, who's still with us, and he's taking your important questions that you asked on social media, and we are here to deliver. So we're going to get straight into it, right, Cole?
Indeed.
So much to cover right now. And first up, we've got something from Belinda Francis, is that correct?
Indeed. So Belinda Francis would like to ask you, Doc, being a diabetic, I have ensured to take extra care. I eat 5 small meals, take my medication on time, drink lots of water, also only 1 fruit a day. What I would like to know is, why does the blood clot and veins thin out eventually, leading to heart problems?
Sounds like it's a good diet though, right?
Yeah, I mean, well done, Belinda. I mean, I think she's doing all the right things.
Yes.
I think what she's referring to is the fact that, unfortunately, living with diabetes still puts you at risk of these vascular complications.
Yes.
And I think the most important thing is that even on treatment, you've got to have regular checkups, because whatever treatment you may be on today might not be sufficient to control your blood sugar kind of 6 months down the line or a year down the line. So there's a special test we do, which is called the Hba1c Test, which gives us an idea about your average blood sugar over the previous 3 months. And everybody's got an individual target for this, which helps us to prevent complications. So even if you're on treatment, you're doing all the right things, you've got to be tested to ensure that your levels are adequately controlled, and that's how you're going to prevent those complications.
So when you have it, it's almost like a good idea to kind of calibrate as often as possible, recalibrate, check in, see where your levels are at, and then continue with the beautiful system that you are already implementing.
Correct.
I like that.
Thank you, Belinda, for giving us that question. Of course, there's a couple more that have come through. Let's go to the next one. And this one comes from Drisha, saying, my son is 12, was diagnosed at 5 years old. Is the pump better than normal insulin shots? Is it accurate in its readings?
So Drisha's son obviously has type 1 diabetes, and that means he's got to be on insulin. And an insulin pump is just a different way of delivering the insulin. And the pump may be better than injections in certain situations, specifically if somebody living with type 1 is prone to really low sugars, hypos we call them. And that way the pump technology, because it comes with really interesting sensing technology that can sort of stop insulin when the sugar is predicted to go low, can be a really useful tool. But having said that, many people can be super well controlled with multiple daily injections of insulin. So it's not an absolute must, but it can be helpful in certain situations.
What is the pump exactly? Is it something that is ingested? Is it something...
No, so it's a little device that the person wears, usually on their abdomen. And it's got a little cannula, and this infuses insulin on a continuous basis. Together with that, you wear a little sensor which measures your blood glucose, and those two talk to each other so that it regulates the blood glucose. And it's getting better and better. It's eventually going to be like an artificial pancreas. We're not quite there yet, but the technology is really amazing.
It's pretty crazy what tech can do these days.
Really
it's
is
assisting
amazing.
the body's organs and functions. That is insane. I know we've got so many more questions coming through. Another one here. This one is from Gail Barron saying, hey family, hey Gail, I would just like to know why the diabetic meds I was put on makes me dizzy. I was diagnosed 3 months ago with diabetes and was given metformin to take, but I'm constantly dizzy when using the meds to a point where I have to lay down. My next hospital appointment is only in Jan. I would appreciate any advice. Until then, thank you very much.
Sure, Gail, I'm sorry to hear that. So the medication you're referring to is metformin. So this is our usual first-line treatment because this helps the body respond to its insulin better. It's an insulin sensitizer. So unfortunately, as with all medication, they may come with complications, and so if that one's not working for you, I think, unfortunately, Gail, you're going to have to speak to your doctor about alternatives, because the most important thing is not just to stop your treatment and allow the sugars to be high. That's going to lead to complications. So I think in this case, it's an opportunity to check in earlier with your doctor and try and see if there's an alternative to that therapy for you.
All right.
You know, education is such a key here, and I think you've given us all the equipment we need to actually face this and make sure that we do the whole beating in diabetes and make sure that we can manage it properly. So, Dr. Zane Stevens, thank you so much for all of the fantastic advice. For anybody who is living with this disease, I think you've given them a lot of solace and calm, and I want to thank you for that.
Thanks for having me, guys. Really appreciate it.
Dr. Zane Stevens, World Diabetes Day. And of course, if you are one of those individuals with diabetes, education and information, credible information, is what's going to get you through. And don't worry, we are holding your hand on your Feel Good Breakfast Show.